We're at a point where society is opening up. A lot of the restrictions and masking is going away. And for the vast majority of people in the country, that is probably okay. If you're up to date on your COVID vaccines and you don't have any significant medical problems, it is probably safe for us to start gathering and doing things again. But there are those of us that don't have that luxury. It's really 3 to 7% of the US population has an immunocompromised status. That could be anybody who is undergoing chemotherapy, who are on medications for autoimmune disease, folks who've had transplants, and many others. And the vaccines don't allow them to boost their immune system enough to maybe give them adequate protection. There may be others who are elderly, who have chronic medical conditions, and they also will need to protect themselves. So we talked a lot about cloth masks at the beginning of the pandemic, and that was really, there weren't readily available high quality masks, and it was for you to protect others if you in case had COVID. But now we're at a point of the pandemic, and as society begins to open up, where people are going to have to assess their own individual personalized risk. And if you do fall in one of those risk categories, you have to protect yourself. So a cloth mask is not going to provide you adequate protection. It doesn't create the right filtration to protect you from Omicron or any other strain that we may have of COVID. So there's two important factors when choosing a mask, and that's the fit of the mask. It has to fit well. There can't be large gaps. And the other is the level of filtration. So that level of filtration, you often hear us talk about N95s. So N95 masks are masks that are generally worn by healthcare professionals taking care of patients with infectious diseases and problems. And they give very, very good protection from COVID. So that's one type of mask that we'll show. What's more readily available and actually a little more comfortable to wear when you're out and about would be the KN95s or the KF94 masks. And these are masks that are meeting a standard of China or Korea where they're manufactured, and they're not a US typically approved mask. But they provide a adequate level of filtration, and they also have a good fit, and they are more comfortable to wear. And that's what you'll find many people protecting themselves. However, there are a lot of counterfeits of these masks. So in the video, we will give some tips on how to spot a counterfeit and how to make sure that you're going to get a mask to protect yourself. Saw a question in the chat, Emily, about schools and masking. And both Dr. McDermott and myself throughout the pandemic have been very strong proponents of masking. It's been a very important tool to keep our communities safe. But I think as we see this current wave going down, we're optimistic heading into the spring and this summer, and I do think it's time for us to start considering unmasking our children in schools safely. That being said, there may be some children who have some conditions, medical conditions, that put them at higher risk, or they may live with a family member that is at higher risk. So those children should wear a high quality mask. Again, do not have them wear a cloth mask. They make pediatric and children KN95 masks, and that's what I would recommend in those specific cases. But for most children, it's a very low risk situation at this point, and we do need to take these opportunities when the COVID is lower prevalence to normalize a bit.
We also have questions from folks about whether or not it's safe to travel and what precautions they should take if they plan to hit the road for business or vacation. Dr. Newman, do you have any guidance to share?
I'm always going to start with be up to date on your COVID vaccines. If you're eligible for a booster, get the booster. That's really going to be the strongest thing that you can protect yourself from hospitalization or a severe outcome from COVID. After that, if you're on crowded spaces, if you are concerned about catching COVID, wear a mask. Otherwise, I do think things are going to be slowly opening up as the prevalence of COVID goes down at this period. We hope it lasts throughout the spring and the summer. Nobody has a crystal ball, but this is a point where if you are up to date on your vaccines and you don't have any serious health problems, that I think it is a time where we can consider traveling and getting back to some normal state of life for a while.
I know there's lots of questions about, well, when to wear and when do I need to wear a mask and those. And remember, in outdoor environments, the dissipation of virus in the air happens much better in outdoor environments, right? There's no doubt about that. Relative to indoor environments, the amount of ventilation is an important factor, the number of people in the room, and then the underlying prevalence of the vaccine in the community at any given point in time. That is always changing. And so the risk in all of those environments is always changing. And everybody just needs to be aware of how prevalent COVID currently is, and then and make sure that they're taking actions in response to that prevalence and in the environment that they find themselves in.
A little bit, and this is something that's been ongoing throughout the pandemic, is vaccine immunity versus quote unquote natural immunity. The truth is both do give you relative immunity, but unfortunately that immunity does appear to wane over time. So this is what we're beginning to follow. The safest thing is to get vaccinated. Don't try to get your immunity through getting sick. That is really rolling the dice and not a safe way to go. But we saw with Omicron, many individuals that have got COVID, for the second time, who had COVID previously in the pandemic. And we saw many vaccinated individuals get COVID. But the truth was those that did have some levels of immunity were less likely to end up severely ill, unless you had one of those immunocompromised statuses. But don't count on either. Unfortunately, the immunity does appear to wane to some extent, and we'll just have to follow the science over time. This is the bit of the uncertainty, and will there be a future booster? Will this be an annual vaccine? Who knows? But I would say one is not better than the other as far as the immunity goes, but you definitely don't want to roll the dice and get COVID to get your immunity. That's a very dangerous thing to do.
This also touches on the concept of herd immunity. I know there were some questions about that, and it's that's a complicated issue with viruses, because not every virus is the same as every other virus. There are different virus types, and those viruses have different tendencies towards antigenic drift and other sorts of things that make previous infection, not like Chris just said. We know there are lots of people that have caught COVID multiple times and have been hospitalized. That natural immunity with a virus like a coronavirus isn't perfect, and neither is a vaccine. They provide protection, but they're not perfect, and you can have breakthrough infections. And so that concept of how close are we to herd immunity, very difficult to answer with a virus like a coronavirus that has the tendencies that it does.